Hi, I'm Dr. Thomas Su here at Artlipo Plastic Surgery, and today I'd like to talk about something that is very unique to our practice and what I do, and it's called the knee complex, or Lipo 360 of the knee, which extends from the upper part of the calf all the way up to mid-thigh. So this is very different from what other doctors talk about when they talk about liposuction of the knee. Other doctors, when they talk about knee liposuction, are talking about this little inner aspect of the knee right here on the inside. And for most people, the area that they're covering is about the size of my palm and fingers right here. That's all that is done. What we're going to talk about today is the knee complex, so extending all the way up to here about mid-thigh, and then all the way down here about halfway onto the calf. And we're going around this area in a 360-degree fashion. And what we're trying to accomplish is a narrowing down, with the middle aspect of the knee being the thinnest aspect of the leg. It makes a huge difference for many patients. If you think about women who complain about the knee bulge, oftentimes that bulge goes all the way around the front of the knee. And if you look in a mirror or look at a photo, you'll see that the knee actually looks blocky, okay? I'll hold this up again. This looks kind of squarish compared to a sloped or tapering look. And when I start doing, I'm going to show you some drawings in a second, and when I start doing that, I think it'll become very apparent. So what you're going to get to see me do is what I would be doing in our virtual consultation. When you send me photographs, I will take your photograph and I can draw the new shape in a variety of fashions. If you send me the whole leg, I can show you how it will look with just the knee complex. I can show you how it will look like with the knee complex, maybe including the inner thigh and the outer thigh. So we have a lot of different options there. So without further ado, we'll set up the camera and I'll show you what I'm talking about with the knee complex and how it makes such a big difference. Thank you. All right, so here we are looking at that same picture I was just showing you, and now you get to see the close-up of it. What I was describing before is this blocky look. It almost looks kind of squarish right here, and we have to get rid of that. This area right here should be the slimmest aspect of the entire leg, and when that happens, the leg is going to look much more beautiful, even though we're not doing anything in the upper thighs or down in the calf. Another problem with someone who has fat around the front of their knee right here is that this bulk right here, actually all coming across here as well as over the kneecap. The kneecap is hiding right here, and there's bulges of fat even underneath it and above it and right on top of it. So all of this fat is actually affecting the beauty of the knee. And when we get rid of all of it, I actually tell patients they're going to have a pretty knee. There is such a thing as a pretty knee, and people don't talk about it, but it's actually very important. Even my smaller and medium-sized patients that have just a little bit of fat, it can make their legs lack that special, you know, that super nice looking quality, and it comes from the knee being pretty. So another thing before I start is that other doctors, as I mentioned, only do this little inner aspect right here. I've seen a few that do this outer aspect. I've seen almost no doctors go all the way in a circumferential pattern all the way across the knee, or in a 360-degree manner. In fact, as I've gone to go to yearly meetings for the American Academy of Cosmetic Surgery and other cosmetic surgery conferences, I've heard things, you know, in lectures that doctors give of what not to do. There's doctors that will be out there talking about how you should never, ever go in front of the knee here. And they may mention it's going to be lumpy and bumpy, or the skin's going to be loose and you have wrinkles. I'll tell you what, we do this on patients on almost a daily basis. So there are a lot of things that other doctors believe that you should never do. There's doctors out there teaching that you should never do it. So I'm one of the few that you will find that can do something like this, has the skills and the experience to do it, and I'll show you what it looks like. So what happens is we start cutting sloping this leg in from up here. We're limited by the actual knee bone, but it's hiding somewhere down right here. Then the contour actually changes and we have the little inner curve right here as we come up over the upper calf. So we have to blend it. When we're only doing a section, we have to blend it. We can't take everything 100% as we come down here. There's still a little bit of fat over a calf, but we're not gonna change that. We're gonna work with what we have. This contour right here is going to change a lot. This is a whole thick bulge of fat right there, and as we bring it down, you see this is the thin aspect of that inner knee. And now that I have the outline drawn, it becomes a lot easier to see when you color it in. This process that I've developed for doing a virtual consultation and drawing has been developed over years. I used to just do a line drawing showing where the new contour would be, and people just kind of go, okay, yeah, all right. And then as I developed this process where I color and shade in other areas, then I could see the look on people's face change when I did this, and they go, oh, now I can see. So now you can see how the entire leg has been transformed. And we have a much more slender looking leg. I'm going to do the other side now. And there you go. That is a leg that has been transformed by doing the knee complex. You can see some of the surgical outline drawings that I've done here, but basically it's this section right here that I've just shaded in. We do everything in a 360-degree fashion all the way around, and you can see that that has completely transformed the legs. In another video, I'll talk about doing thighs, but I'll go ahead and just show you a little bit right here. Some people say, you know, okay, well, Dr. Sue, you know, what if I wanted my inner thighs treated too? The traditional area of the inner thigh is this area right here. That is what other doctors treat when they treat the inner thigh. But when I do a lot of patients, they would benefit the most by doing their full inner thigh coming all the way down and including the knee complex. Actually, before I move on, let me do this, okay? So just to show you again our initial patient's shape, how her legs look thick and blocky around the knees versus the knee complex alone. And then what I'm going to show you here is the inner thigh also. So this would be, what I'm showing you right here is a full inner thigh, including a knee complex. One of the combinations of many combinations that we can do to do treatment. That would be including this area right here too. So if you look at both pictures, you can see from side to side how much difference that makes. Okay, that would be a full inner thigh and knee complex. So I appreciate you watching. What I was talking to you about, and I'll try to show you a little bit right here. The kneecap is right here, and when we remove all this fat around it, you actually get to see a little bit of the kneecap, and this is the best representation, but if you can actually see a kneecap right here and the shadowing around it, you can see how that makes the whole knee look much more pretty than with just this bulky stuff that you see that's still left on the other side. Okay, thank you for watching. That would be the knee complex. And here we'll go ahead and show you a few of the examples of actual knee complexes that we've done before and afters. Thank you.